I'm Oliver. I work for a Hook as a consultation nurse. Predominantly a lot of my role is telephone triage, come through into the out of hours in the evenings, weekends, and also the clinical assessment service. I think it's helping us to get a better understanding of the patient. Previously, when we're asking all these, a lot of questions around history and drugs, a lot of the feedback from the patients on the phone at the time is, do you not have that information in front of you already? It's better for the patient journey. You're not having to ask them, what's your past medical history? What's your drug history? We've got all that information there now. You're not having to go to another system to have a look. You've got an elderly patient that's on the floor, hit their head, and you don't want to be asking them, oh, you want any, blood thinning medications? Because they're probably not going to be able to answer the question anyway, so in some cases. So having a flick to that tab and, looking, it can save a lot of time, and we can get the patient where they need to be. Extra information that we've got is useful, when the medication stopped, when they began, what they're being used for. Obviously, medications have got different purposes. What referrals they've got in place as well. That's very useful. Yeah, we all have different systems. It's what works best for everyone, but then they all need to work together. For the patient, because in some instances, if we didn't have that information, we might be sending that patient to A&E, and the patient probably doesn't need to go to A&E, might benefit from a home visit, or just even calling a family member. Maybe we don't need to see the patient in the out of hours. The out of hours resource is finite as it is, so we want to make the patient journey seamless, got a different outcome. You've prevented an admission, you've prevented an ambulance that could be going to someone else with the heart attack or a stroke, and you could have spoken to another 3-4 patients. If you have one system, one care record, it's just so much easier for you as a clinician, not just for the patient, but it's about you, isn't it? And you're not working outside of your comfort zone or scope of practice. You work practicingly safe at the end of the day.